Hello YouTube family, this is Dr. K from PCH MedSpa, and I want to talk about a very interesting topic, a very trendy topic, the blue peptide or the glow peptide or the GHK-Cu, aka copper peptide. A very interesting story about this peptide is this is a natural occurring peptide that is in your plasma, your urine, your saliva, and this is a small protein that will signal repair. Now, the interesting part, how to activate this peptide is through injury. You get a little cut on your skin, you get a laser treatment, endolift with Dr. K or something of that nature, and the collagen gets injured, and this GHK fragment is a little fragment or a little small protein gets released in the blood. And this will absorb and attract copper. And guess what? Copper is toxic for the body. It can actually harm the brain and the body. When it attaches to the GHK, it forms this peptide, which we can manufacture and prescribe. GHK-Cu tells the body power mode on and repair mode on, and it will signal the body to behave like 20 years ago when you were younger. You had more stem cells, you had more blood vessels, more blood supply to the skin and your hair. And basically, these signaling pathways will help your skin to create more collagen, type 1 and 3, get your basement membrane repaired and get a little stronger. The matrix of the skin will improve. You will have new blood vessels in the skin, and it will also decrease inflammation. I do use it on my patients after my endolift or more intense laser or even Morpheus patients. Why? Because the recovery will be faster. They'll make more collagen, so that will help me get better results at the end of the course of the treatment, and also increases blood flow, which means better results. And guess what? Also decreases your cancer-related pathways, which is very interesting. For the hair loss, it's also very interesting because this peptide will help to regrow new blood vessels. That means new blood to the follicles, something that Rogaine does, for example. Also, the mechanism of hair loss is that you get less blood flow over time. You also have some damage to the stem cells around the follicles in your scalp. So that will end with shedding. And also you have the collagen damage or collagen rippling or shrinkage, which will kind of suffocate the follicles. So when you use this peptide, now you can use it as a serum, which is manufactured in our compound pharmacy, or of course injected. Per protocol, you will have more collagen and the follicles can breathe better. They will get more blood supply and it will help the stem cells to rejuvenate the hair follicles. And yes, when you do this per protocol for a period of 3 to 6 months, it will definitely help you with hair. Of course, these are all experimental. There's not all these billion-dollar companies behind them to do all these studies. But if you do it right, not from the TikTok bodybuilders, of course, that sell it online, and you get the right source, you have medical supervision, and you do it right per protocol in combination with other treatments. So this is just one piece of my hair restoration program, for example. And of course, is one piece of my skin rejuvenating and my non-surgical facelift protocol. It can definitely help you get better results. It will be very safe. One protocol for this is to be injected for a certain number of days of the month. But of course, if you like to know more and also figure out if this is right for you, because this is not for everybody. This is not for a pregnant or lactating woman. This is not meant to be combined with a strong vitamin A, derivatives for the skin, or vitamin C. So there's a lot of details, and you need, again, the right consult and the right protocol with a medical doctor. Definitely comment protocols below and leave your information. We will reach out to you and set up a complimentary consult to tell you more and see if you qualify for this treatment. It's very, very Interesting, we do use both. So this is a serum that we use a number of times on the skin or scalp or the body per day, of course, right before your creams. And this is, of course, the injection. Hope that helps you. Comment and we will help you out even more. Have a nice day.